The information provided in this podcast is educational and not intended to diagnose or treat medical conditions.
Dr. Doni Wilson struggled for decades to solve her numerous health issues and heal her body. But with focused determination, she healed herself. And in doing so, she discovered the Dr. Doni Stress Recovery Protocol. On this show, you're going to hear from doctors, nutritionists, and experts, along with Dr. Doni, who will give practical advice and wisdom to help heal your body. This is How Humans Heal.
Welcome. I'm very excited to introduce you to my friend and colleague, Dr. Paul Anderson. He's a naturopathic doctor and clinician, educator, and author. And his most recent book is called Cancer, The Journey from Diagnosis to Empowerment. Thank you so much for being with me today, Paul.
Thank you so much for having me. It's great.
It's so much fun. I mean, I always like to mention that you and I went to the same high school, not the same time period, or not the same year, but we graduated from the same high school.
That's, I was so amused when I found that out. Yeah. Just a number of years apart, but the same high school. Yeah. That was amazing. Wild.
That's amazing. Yeah. And this is a high school in Oregon, and Paul's, I think, now located in Washington State.
I am, yeah.
And you've been practicing as a naturopathic doctor for, is it almost 30 years or more than 30 years?
Almost, yeah. Yeah, I haven't quite got the anniversary yet, but close.
Close to, just about. And not only that, but you've trained, I think, probably more naturopathic doctors than anyone else I can think of. You know, just you're more than just helping patients, you're really helping other naturopathic doctors to provide the information that you've discovered and learned and supported people with along the way. So I really want to acknowledge you for that, because you're just such a giving person. I see it with you giving in the profession to your patients and to your family. So I really want to let people know that's part of Paul. It's just such a giving nature. And what brought you to do what you do?
Well, so that's a really long answer, but the short answer is what got me to naturopathic medicine originally was I was working on the allopathic side of medicine, which my family is involved in, and my children, I have 5 children, they're all adults, but my older 2, who are they're in their 30s somewhere. They're old people now. With the older 2, when they were little, they were having a lot of trouble with what turned out to be a lot of allergies and ear problems, you know, the normal kid stuff. And we kept going, you know, to the pediatrician and kept having stuff happen. And my mother, who's a nurse, said, you know, I know this naturopathic doctor, you should probably, you know, take the kids there and see if he can help them. And I thought, oh boy, you know, whatever. And so then, you know, then one of the kids got sick again, and she says, no, you really ought to go talk to this guy. And I was just so impressed with his breadth of knowledge and ultimately how he helped the kids and how he practiced. And I thought, you know, I could actually do this. And that was a long, long time ago now. And then that just sort of led to, I had been a teacher before. I'd done a lot of professional education before for people, especially lab people and, you know, stuff. So I always taught because it's something I just have to do. I really like it. I like teaching and writing. And so as time went on, my teaching sort of shifted, especially in the last like 15 years to how do I help people in, you know, our profession, but also in integrative medicine, other professionals, how do I help them not make the same mistakes I did? You know, because there's no point in us repeating our mistakes or other people repeating them. So that's really been where most of my work has gone. That and writing. I've always done a lot of writing for professionals, but I'm writing more for patients now. Same reason, just to have information out there for patients. So that's the Cliff Note version of my story. It's a little more twisty than that, but that's it.
Thank you for sharing that, because I think that a lot of people will be inspired by you and what you do. And I know that you give so much in many ways. And I think that my impression is that, say, in this your recent book, this journey from diagnosis to empowerment, was that inspired by your patients? What inspired that book?
Yeah. Like everything in life, it's when you live something or live through something or live with something, it's a lot more personal, and it's it becomes something you either want to do something about one-on-one, say doctor to patient, or in this case a little broader, my experience to other people. So what happened really though is the previous book that Dr. Mark Stengler and I wrote together, called Outside the Box Cancer Therapies, was focused on, as the name implies, integrative cancer therapies, because that's what we both did a lot of. And it's that book's been it's in, I think, 5 languages now around the world.
Wow.
It's been very well accepted, even even in maybe places that wouldn't have normally, because we had a real high research bias to it. But when we got done with that book, I had a clinic here in Seattle. We treated about 75% cancer patients. The rest were chronic illness people. And I was really mentoring the doctors who worked at the clinic more than directly treating the patients, because I was doing so much other stuff. And the thing after the first book came out that I really noticed was we didn't have space in that book to talk so much about the mind-body connection and the internal part of what goes on when either you yourself get diagnosed with cancer or a loved one does, because it's very traumatic for both people. And the bottom line is it's not easy. There's no easy part about the journey, but the better that you can do with it and the more you embrace empowerment within it as a patient, the better your outcomes are. Your quality of life improves, your family relationships improve, even I think the response to treatment improves. So I saw this as a place where beyond whatever you're doing about your cancer, whether it's just you're going to pick the standard route to go with your cancer because that makes the most sense, or you're going to do some integrative stuff, or whatever you're going to do. That part doesn't matter. It's what happens when I get this news that I don't want, that, my loved one has cancer, I have cancer, and how do I get beyond that to being empowered and kind of in charge of the situation and not a victim. So that's really what triggered the book. And the book, it's hard to write on one level where there's a lot of editors involved, a lot of people helping me get the message smooth, right?
Yeah.
But the content was not hard to write because I'd lived it for so long. And, I'd really I've seen people kind of navigate that pathway really in a positive manner and really positively affect their own outcomes. And I've seen people, kind of get stuck with the tragedy of the diagnosis and being upset about it and not really navigate it, and their quality of life and even their length of life decreases. So that's why the book came about. And the other thing is the people who read the first book, it was longer. It had over 1,000 references. It's a big book. This one is really an easy read. There's not a whole bunch of references. There's some, but it's made so any person with cancer, anybody with a loved one with cancer, can read it quickly. There's a lot of resources because we all get stuck in different places, and it's a very user-friendly read.
Do you recommend it then? Like, if, say, someone first finds out they're diagnosed, that's when they should start reading this book?
Probably is earlier is better. In my thinking about it and going through it with people, a lot of times we don't have the luxury of timing. It might be you might be a year into the process, and I think there's benefits both ways. So let's say you're a person who you or your loved one just got diagnosed with cancer, it's a good read right then, because it kind of just wraps your head around what's going to happen to me on the inside as I process this. But also I've had people where they've been kind of working at dealing with their cancer for a year or two, and they actually got different things out of the book because they've already sort of been down the road a ways, and they've seen some of the places people get tripped up, and they they see it for a little bit different than maybe someone new. So it's kind of written to meet you wherever you're at. Yeah.
Well, I definitely see like that it's filling such an important need for people, because cancer is an example, but I see this happen with a lot of different illnesses and chronic illnesses in particular, where the illness itself becomes a stress. Usually it's our prior stresses in life and toxin exposures and so on that create the illness. But then once we don't feel well, or we're dealing with the medical system and medical process, that becomes another stress. And when I think about it, I think of it like, well, any way that we can solve for that, any way that we can support ourselves through a stressful process, it's going to help us in the end. And that's what you're suggesting. And I know I've seen that in the research. Do you have any, I'm thinking, is there any research that comes to mind for you that shows, that when we support ourselves through a process, that it's going to work out better on the other end?
Yeah. That's specifically, that's the only research I actually included in the book, because it's you have a fair amount of credibility if you've lived something for 30 years or so doing something. But I have a section called "What Does Modern Research Say About Empowerment as a Patient, or Empowerment with Cancer?" And right up to the time where I had to stop writing, which was just which wasn't long ago. There were new studies being published about empowerment, especially around cancer patients. And it because that wasn't a focus of the previous book, I was even a little bit surprised at how specific the studies were. And they were looking at either family members or patients with cancer, and they would look at very specific things that anyone with cancer knows can be an issue, such as their general outcomes, their quality of life outcomes, but also things like pain management, and other things we think of. Well, okay, I'm empowered, so I'll feel better about myself, but that's not going to affect my pain, or that's not going to affect my whatever physical thing. Well, it turns out it does. So what I did in that section, which, like I said, is the only real research oriented section, is I shared, the most recent things that had looked at these kind of broad areas, and just, quoted from them so that people could see there's actually research that goes on around this. And they make a distinction, which I thought was really cool, because it thankfully it's the same distinction I was making in the book, which is your, empowerment is really your ability to feel autonomy and self-determined and all of that. It doesn't change the fact that you don't like your diagnosis. Autonomy and empowerment is not being a Pollyanna or ignoring the fact that you have something going on with your body. It's saying, if I'm going to be dealing with this, I'm going to do it the best way I can. I'm going to be the person in charge of this, and I'm not a victim of it. I am literally the master of my fate, and I am wake up every day and decide that I wouldn't choose this, but since it's here, I'm going to move forward. And that, in all of the research that I read about it, especially like in the last 5 years, where there's been a lot of research, that was just remarkable how much difference that made with both mental, emotional, but also physical parameters around cancer.
It's so amazing and cool, and I think it points out exactly what probably a lot of people are wondering and thinking, like, how can I, because we can feel like we're in the struggle, and like you said, feel a victim to many health conditions, including cancer. And it's like, how do I get out from under this? And when we can, it's almost like a mental expansiveness to be able to find the space in our psychological experience to be able to make space for this and say, hey, I can stand back and be somewhat of an observer and see this in a way where, like you said, it's not something I would have chosen, but it's here. So let me look at it in a way that I can move forward versus being overcome by it. And that's so awesome. I love that, to hear that there's studies on that too, and that's what you're writing about to help people with cancer. It reminds me, actually, as in my training as a midwife, what I studied was women in labor and how that fear and stress would affect them. And to see that, as labor as a process, it's something where a lot of women, I think, are like, okay, I want a baby, so I guess I have to go through that painful part, so but at the same time, we'd rather not be in pain. But the thing that's interesting that when they study labor is that we need a certain amount of stress hormones, cortisol and adrenaline, to get through it. And if we don't have enough stress hormones, labor doesn't progress. But if we have too much stress hormones, labor doesn't progress either. And this is where the role of like a doula comes in, a labor support person who can say, hey, here's what's involved, here's all the decisions, here's a way to think about it, here's tools and techniques to support you so you can get through the labor process more efficiently, more, with fewer negative outcomes, with more positive experience by having that labor support. And so it sounds like, to me, I hear it as what you're proposing is like a doula for cancer care. Like how to doula yourself and support yourself through cancer care so that it doesn't have to go into that, the overly stressed realm where it's working against you. You want to be right in the pocket, so to speak, where you're engaged in this treatment process, but you're doing it in a way where you're supported so that you can get through it with the most positive outcome possible.
Yeah, that's exactly it. And it's like you say, our stress response, is you talk about with people all the time, I'm sure, the stress response is there for a good reason. It's just that it's supposed to sort of have an up and a down and a balance in the middle somewhere, even during, very stressful physical times. And one of the things that I've seen over and over with chronically ill people or people with cancer, et cetera, is the stress response can either be blunted and muted, in which case then you don't really get a great immune response, you don't get a lot of other things, or it can go too far, especially if mentally and emotionally you can't settle, and work towards kind of an empowered state. The stress response will take over because you feel out of control and you feel like a victim, and your stress response just spins out of control. And just like with labor and delivery, if it's too high, things don't progress well, they don't end well. If your stress response doesn't have this sort of sine wave up and down, and it's just spinning out of control because you feel like a victim and you're angry or you're sad or whatever, your response to your treatments, your body's immune response, it just goes off the rails. So, it is literally that important. And that starts, honestly from within, for the most part. Yeah.
Something a lot of people don't know is that too much stress can actually create an abundance of health problems like high blood pressure, high blood sugar, anxiety, migraines, insomnia, even fertility issues. This is because high stress puts your adrenal glands on overload. They release cortisol and adrenaline, which controls your digestion, hormones, immune system, energy, focus, and even your emotional response. So how can you beat stress when you don't know where to start? That's why we have a free 7-day stress reset program. It's designed to help support weight loss, digestive healing, and hormone balancing. It includes support for integrating self-care, daily tips come to you by email and video, gluten-free, dairy-free meal plans, as well as grocery shopping lists, journal pages, and more. This free program will help you beat stress and put you on the path to wholeness in your body. Get your plan now for free at drdoni.com.
What are some of the tools that you might offer in the book or offer your patients when they're, when they're in that, where they feel like they're spinning with the stress, and how to kind of find their way back?
Yeah, it's that's a lot of, I would say 80% of the book is really just a pathway for that, because and it literally was built from deconstructing lots and lots and lots of patients back to where do they start, and how do we feel there, and what would be a good next step versus not a good next step, and moving on.
Mm-hmm.
And so the first thing though that really struck me as I was writing was I wanted to make sure that people understood that it's not abnormal to feel surprised or angry or upset or any number of emotions when you or a loved one gets a cancer diagnosis. Those are normal things. So the book and my counsel to the patient is not saying, oh well, you shouldn't feel that way. It's saying, that's totally normal, and we all get a different thing. If we get a shocking diagnosis, some people get angry right away. Some people become afraid. Some people get really depressed. Some people, kind of fall back and, and have a lot of denial and things. So it's not, those are the human condition. So pretty much every chapter, I start there's a little what to do next box at the end of the chapter. And I usually start saying, hey, it's okay to feel this way. This is normal. But here's some steps you can take to move to the next level, or here's some steps you can take to deal with it. And then the what, as far as what to do, depends a little bit on what, which area you're at, because that's the other thing. We all have our own strengths and weaknesses. So some people are great at the beginning. They realize, look, okay, I'm in shock. I was a little angry about this or whatever, but I know I gotta move forward. Their trouble is then, what do I do next?
Mm-hmm.
Other people, they don't realize that they need to move forward, so they need a little more help there.
Mm-hmm.
So what I really do is put in the roadmap and then a lot of resources for people, because we all have a different, we all have strengths and we all have places we get stuck. The other thing is there's a lot throughout, because it really is for loved ones and supporters as well as cancer patients. There's a lot making the point that the people around you are part of you either healing or not healing. And so, and the other thing about people around us is they don't want us to have cancer either. They're just as upset as we are, just probably in a different way. So the point with the book was, well, if we can all process in our own way and be moving towards a healthier, more self-determined place, then I can be a better supporter for you. You can, be in a better place as the patient, etc. And I think that becomes that became a really important part of what I wanted to bring out. Was it's not just about, me, the patient. It's, me, the patient, but I'm surrounded by people who are part of my world, and they care about you, but they may, people aren't born knowing how to deal with something like this. So that's a big part of it. And then the other thing I did, which I had this idea, but when you write books, your editors sometimes say that's a great idea or not a great idea. But I had this idea because the book has a lot of, it's very down to brass tacks, kind of, here's where you go next. Here's how you deal with maybe family that don't want to play ball or whatever. But I wanted to tell stories. So I picked two patients, they're real life patients, who kind of went two different directions with empowerment.
I love it.
And throughout the book, I talked, now obviously they're de-identified and I changed their details, but but the emotional part was the same. So each chapter kind of has this story of these real people and how did they handle this part of either dealing with their diagnosis or dealing with family or dealing with, the shock or the anger or whatever. And thankfully the editors said that was actually a good idea because
Yeah.
it brought some humanity to sort of a technical, type of a book. So for people who are, more emotionally relatable, they can read the story and kind of pick up the same tips as the people who like the bulleted points and all that stuff.
And that's the thing is, I mean, that's so useful, I think, for people to hear specific stories. I was going to ask you if there was a story
Yeah.
you could share, but I was also thinking that, it's the thing about when something happens in life, like say it's a cancer diagnosis or whatever happens any day, of course it's being in the world that we're in is going to trigger any emotional growth. That's the way I think of it, is that's the growth that we're ready for or meant for. And so
Yeah.
to kind of start to realize, even if say as the caretaker or as the other person in the life of someone with cancer, or even the person with cancer, to find that, I like how the words you're using about that kind of self-determined, and kind of finding the place where you can realize, hey, this isn't just something that happened to me. This is my life. And this is my chance to know myself better and be present with my emotions and learn how to get through a stressful, challenging time. And to see as what happens to us as living life, as the thing we're doing here. And it sounds to me like what you're guiding is a lot just guiding people to be present with the process and present with whatever comes up for them, because of course, like, if we, of course, whatever comes up is what was meant to come up.
Right. Yeah. And that's why I tried to kind of lay the steps out in a way where they were fluid and open in that manner, because like you say, not everybody, needs to learn lesson A and B because lesson C is where we're at, or some people it's like they already did lesson C, but A is, something that they never really had a chance to, dig into. So one of the pieces of advice that I give in the book is, read it quick first, just kind of see what resonates with you, and
Mhm.
then go deep in the areas you feel stuck at, and you can always, recycle later or whatever. And it is true, and I think one of the difficulties in talking about it is it's whether you're giving, say, the advice or some counsel or guidance and you don't have cancer, or you're the cancer patient, there can be this misconception that, well, nobody wants this diagnosis, this is a bad thing, and so telling me how to deal with a bad thing is not an appropriate thing to do. And in reality, the best medicine that you can provide somebody is actually helping them deal with something that's very unpleasant and very unwanted and all of that. Because whether it's the chronically ill people that you and I deal with, that they don't have cancer but they have something that might not go away or might not get totally better, or whether it's cancer, if you don't do these things and deal with it, you're not helping yourself at all. So it's that's really the focus, is trying to laser in on where do you need the most support and what's going to help.
Well, and I think that's such an important point, that so much of the time people don't know what do you say to someone who has cancer. Do you say,
Yeah.
I'm sorry? Do you say, how can I support you? Like, so to have a book to guide us, to say, here's what works for supporting someone with cancer, so that the person knows you're there to help them, and it's not going to make them feel worse. It's going to actually help them in their process.
Yeah, that was the so of as I said, most of the book is pretty much in stages for the patient or the loved one. there's two chapters that are unique. One is a chapter where I interviewed people with cancer or people who were loved ones and supporting someone with cancer through a process. And I asked them all the same questions. And I felt that the very best advice around things like, what don't you say to somebody who just was diagnosed? Or if you have a family with a child with cancer, you know, what's the best way to help them and what's the worst way to interact? That advice came best from people who had lived it firsthand. And it was wonderful. These were all patients of mine that were more than happy to share this, because they said, you know, there's not really a playbook for this. You don't know how to talk to your neighbor when they tell you, you know, they were diagnosed with cancer. And so they were very open. They gave really good advice. And that was just golden. Because, you know, I could say it from my point of view as somebody who, you know, who is a helper. But when it comes from people who've lived it and they've heard the right things and they've heard the wrong things said or done, it just is very, you know, so for a lot of folks, especially your people who don't have cancer but want to be supportive, there's a lot of gold in those interviews.
Oh, that's how wonderful that you know that they shared that and offered that. I definitely could see where that would be helpful and really able to shift the experience that patients are currently having. I know that from the patients I work with who have gone through cancer treatment process or after cancer treatment, you know, I can relate to what you're saying. Just, you know, those memories from what they've shared with me pops in my head. And one of the I find toughest parts is when people finish their cancer treatment, because so much of the focus is on the treatment that it almost is like, what's after that, you know? And there can be kind of a a cliff almost, where you finish your cancer treatment and then what, you know? And I've seen patients really struggle with after cancer treatment. And so I've now started to talk to them about it during their treatment to help prepare them for after, so that there's a continued path. I don't know, have you found that too, that there's sort of a after your cancer treatment that needs to happen too?
Oh yeah. And it's you know, that's one of those things. Of course, if the patient or the loved one is kind of further down the trail and they've been through that, they've experienced it. But a lot of times, if you're early in your diagnosis and treatment, whatever your treatment is, it's all encompassing, because it's like there's all these things, you've never done them before. They take a lot of time, they're physically taxing and all that. And so you almost can not deal with a lot of stuff then, because you're just overwhelmed with the medical world and process. But you do get this sort of letdown effect then when it, you know, when that maybe takes a break, or they're done with it for a while or whatever, or they're going to wait 3 or 6 months and do another scan. And then suddenly it's like, well, now what do I do? And that's often when people start to try and wrap their mind around how do I deal with this? What I try and do in the book, there's a chapter, and it's, some people get a little confused by the term, but I call it the external cancer journey, because the whole book's about the internal mind-body connection. The external journey really is how it's happening to your body, you know, the treatment and all that stuff. And what I explain is that after looking back at 3 decades of people with cancer, there's really 4 positions a cancer patient goes through. The first one is primary prevention, where you don't know you have cancer and you're trying to avoid it. Most people are not that interested in mind-body stuff around cancer there, because it may not happen. But the second one is diagnosis and active treatment. And in that one, your bandwidth for other stuff, even doing mind-body stuff, is lower because it's very busy.
It's so intense.
You don't feel good, etc. The third part, though, is recovery from active treatment, which is actually a really critical part of cancer care, because the better you do recovering, the less likely you have a recurrence.
Yeah.
And then the fourth one is secondary prevention, where maybe you're in remission or no evidence of disease, et cetera, but you're actively working on not having it come back. And in the kind of those third and fourth phases, you have a lot more time to think about how this is affecting, your mind and body, or your mind and body and spirit, or however you want to divide that up, the internal stuff. So my advice normally is, if you're spending most of your time getting treated for cancer, you're dealing with the diagnosis, but you also don't feel great because of the treatment and all that stuff, you're really doing just baby steps and basic things, just kind of, it's getting through it. But when the fog lifts and they spread out your treatment, or you go into a treatment break, you can be left feeling like it's like all that hits you. And if you're not ready for it, not ready to start processing, that's when people often, do have trouble. So you have to be, life is about being realistic. And if you're already maxed out and you feel horrible, that's just little things you can do. But once you get into that break time, or waiting to see if you're in remission or whatever, that's when what goes on in your head really, it's that's 80% of your efforts at that point.
I could see where your book would be a real resource there. I mean, all of those phases. I love how you're breaking it down into these phases, and to realize there's different needs at different phases, and to really point out that recovery and remission phases are important times for this mindfulness and empowerment process to happen. You're making me realize I've had cancer in family members, so I have my personal experience with being around family members that were going through cancer treatment, and I myself recently went through a process of being going through a diagnostic process, is to find out if I had cancer cells. And so I can relate on, it's coming to life for me personally. And luckily, I was just, mentioning to you that I just received results back that my biopsies were all negative for abnormal cells. And so I'm so grateful. It's you feel so grateful when you get that result. But it also gave me this opportunity to be in this doctor's office, in the surgeon's office, where patients present themselves when they have an abnormal growth or something going on, and we're there, and I could really see and know that fear that can happen, where that not knowing, and that process takes a long time. I've been kind of joking that each step takes another week. By the time you schedule with this doctor, it's another week. And then by the time, okay, we're going to schedule you for a biopsy, that'll be next week. And then now we're going to schedule you to see the other surgeon, that's going to be the next week. And so everything is like, and then you're going to get your results in another week. And so it takes time. The diagnostic process alone is stressful. And all along you're in this. And I think a lot of it for me was the not knowing how to get comfortable with the unknown, right? Because so much of it is in this whole cancer process is whether you're before you're diagnosed. And in my case, I wasn't even diagnosed with cancer, but I went through this preliminary process of not knowing until you finally know. And what I kind of realized is that really in life, so much of it is we don't know. We just don't realize it all the time. It's not apparent to us all the time that we don't really know if we have cancer. Actually, at this moment, because I just had a PET scan, is probably one of the only moments in time that I'm pretty sure I don't have cancer. But it's like it makes you realize that sometimes the not knowing, that being in limbo, the waiting is also quite stressful. And I'm sure that's what you talk about at that phase of like the getting diagnosed part. How do you do that journey in a way where you can, be present and empowered and be prepared? Because once you do have a diagnosis, whatever it is, you're going to want to be ready to be in that moment and be prepared to respond and do what you need to do at that moment.
Very definitely, and you're right. Just the nature of the process is so drawn out sometimes that that actually adds to people's anxiety. And if, as is common with all of us, if you haven't dealt with certain things about, your fear of the unknown, or your concern about how you're going to handle, either positive or negative result, or any of those things, that's when those, because you have nothing else to think about, that's when those things really, um, get turned up.
Mm-hmm.
Um,
Mm-hmm.
and so, yeah, the process just is inherently punctuated that way. And there's sort of two, I mean, it happens all the time,
Mm-hmm.
but there's two real big times where that happens. One is what you described kind of on the front end of, do I or don't I have, cancer, or what in the world's going on? Because I don't feel right, or there's this going on. The other then, and I did a podcast recently with a gentleman who's a stage 4 cancer survivor for many years, and he tries to help other cancer patients. And the thing that he and I talked about, which is the same dynamics just a little later, is once you get to the point where you might be stable or you're done with treatment, then every time you get a new scan, or every time you get your tumor markers or whatever, it's like this giant suspense filled waiting game. And it can really tank people mentally and emotionally. It can just drag their spirit down. And what, he and I were talking about, because as a patient, he's been through it way many times, and I've been through it with patients, is the hardest thing in the world, but probably the most important thing, is to put that in perspective. So let's say you're waiting on the front end, or you're waiting now to see if you're still in remission. The perspective that you kind of have to wind your way around to, and I was really happy that most patients who've been through it a lot finally agree with it, is nothing that you do that causes you worry or upset or consternation, which are normal parts of being human. None of that will change the outcome of your scan. None of it will change, your numbers or whatever. And so you have to hold them in a realistic place, which is, they are what they are. I've done everything I can do to this point, and all of the, negative emotions and negative self-talk and whatever else I put myself through, none of that's going to make my scan better, or worse. And that's probably one of the hardest things, because you're literally saying, I don't have control over this. And when we finally settled on the title, the subtitle being Journey from Diagnosis to Empowerment, empowerment is not about you having control over everything, because we can't. We're human. We don't have control over everything, for anyone who thought that. And even one of the studies I was telling you about that was very recent was, they make that distinction that, empowerment in patients where they have these better outcomes is not about them being in control. It's about them being, self-determined and having autonomy, and realizing that they may not be in control of the outcome of the test, or, maybe how the surgery goes or something like that, but they are in complete control over themselves, how they process, how they deal with whatever happens. And that's what makes the difference, So I think that, yeah, the waiting is torture. The waiting on the other end, when you think you might be in remission but you don't know, that's very torturous. So one of the things that I try to guide people through in the book is, well, how can I get myself to a bit more centered place? There's no way that you can be waiting on a cancer positive or negative, marker diagnosis, and not be a little upset by it. That would be unhuman. But you can get to a place where you have more of an empowered view over it, and that's really that's the real point.
Wow. Oh my gosh, Paul, thank you so much for writing that book and sharing all of your decades of experience with your patients, and for being here with me today. I mean, that, I think, really is a powerful message for people to hear, that you can there's some things that happen in life and stresses that we have no control over, but if there's a way we can recognize our humanness and find a way to be present with that, then that's a huge gift to people. So thank you.
Thank you so much. This has been a lot of fun.
People find the book, Paul?
Yeah, that's a wonderful question. You can get it anywhere where nowadays where we're doing everything online, any online book outlet. Of course, Amazon has it, but Powell's Books, Barnes & Noble, etc. It's available right now in Kindle version and also as paperback. You can hold it in your handbook. And I'm actually next week going to be recording the audio version. Audio version will be available through through any audiobook outlet when it gets put out. So, whether it's Apple or Audible or Google or whoever, any audiobook, that probably will not be until January 2021, but the audiobook is coming. So right now, the Kindle or the paper version, anywhere where you buy books online. And if you just start writing, what I found is cancer, and then the journey from diagnosis, usually then it comes up. So that's...
If they write in Dr. Paul Anderson, they're going to find that book and much more that you've written.
Yeah. The Amazon profile should have the other stuff too. You do have to be careful because there's a lot of Paul Andersons in the world. So,
okay. So we want
I
Paul
have
Anderson.
An extremely common name. So there's other really wonderful authors who I'm not. So.
Okay, good
Yeah.
point. And if anyone wants to be in touch with you, otherwise, is there a good place to reach you?
Yeah, if right now probably the very best is there's an info or a help button or whatever. The website consultdranderson.com, just consultdranderson.com. That's the best place. There's a link there to a page called Dr. A Books that has info about other books and stuff. And there's I do a lot of health blogs and things on there too.
Awesome. Oh, thank you. I'm sure that people will find that as a great resource. I know I do as a practitioner too. Any practitioners listening, I know you also do constant regular practitioner trainings and continuing education on. So that's why I say you're such a giver and providing such a service to all of us, both patients and practitioners. So thank you again.
Thank you.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.